So the new graduate program for our nurses here at UMass Memorial Medical Center is a 1-year long residency where newly licensed nurses apply. We take 3 cohorts annually, and they're supported through their journey to practice with the help of our team here at the Med Center. Thinking about the longitudinal aspect of retention, at the 1-year mark, we hover between 90 and 94%. At the 2-year mark, we hover between 88 and 90%. So what we have found historically, especially pre-pandemic, is that our new grads stay because there's a wealth of opportunity for them to grow and reinvest. The Nursing NSI Solutions data reports that on average, the turnover rate is very high for new graduate nurses within the first year. Some organizations report that it's upwards of 31% turnover or a retention rate of 69%. So we are well above the national average for our retention at the 1 year. What is the future of our new grad residency program? I think it's going to continue in its structure. I do believe that we will continue to look at what our vacancies are and adapt, but what I think I'm most proud of is that this framework has been used for other disciplines. So we recently partnered with our colleagues in respiratory therapy who have modeled their entry to practice for respiratory therapists in our framework. Certainly the curriculum is different, but really the support that we provide to our new colleagues that is so pivotal. We've also leveraged this structure for our LPNs. So we have an LPN to transition program as well. It's not as long because we utilize LPNs in our ambulatory clinics, so the needs of our end users are a little bit different. But I think that is the future of our program. We are nationally accredited through the American Nurse Credentialing Center, so we will be preparing our document for reaccreditation and redesignation in the next 18 months. So what is included in our program that makes ours unique compared to other organizations? And I would say our framework is we segment the support based on the learning needs. So the first 13 weeks of our program is a blend of classroom and clinical time. They come together 1 day a week and they get peer support. In addition to clinical concepts that are very broad, and it's not to reteach nursing school, that is not the focus of our residency, it's more to connect the dots. So what did you learn in school and what does that look like here in clinical practice, especially if they didn't do clinicals with their school at our facility. And then after the 13 weeks, they come back together monthly and we give them a little bit of content. For example, the first month after is, code sims, so that they pull the pieces together of everything that they've learned, both in the classroom and with their preceptors, and then they can put those pieces together. And then lastly, we try to weave in concepts of quality and patient safety really throughout the curriculum. But towards the end of the program, we actually have them do evidence-based practice work around what are the quality and safety measures, what do they look like at their local unit level, and what are their ideas to improve quality and safety throughout, their practice. And we have members of our quality and safety team come and hear their presentations and their recommendations. The essence of our new grad residency program is really to create and cultivate a culture of support. And so we boil it down to our 4 C's, that we are committed to seeing them be successful. We select the right candidates to help them be successful. We create a sense of community for them, both in the classroom and in our units. And we maintain and strive to keep them connected to the work that they're doing. And the importance of the work that they're doing. Healthcare has changed so much over the last few years that, trying to support them and give them tools and resources so that we maintain caregiver safety. We help them find joy and meaning in the work that they do. And ultimately, our patients get the best care. So pulling all those pieces together, I think, is what really makes our residency program possible.